Joining us today is Dr. Vishal Sharma from Lakeshore Eye Care. Dr. Sharma.
Good to see you.
Good to see you. Thanks for joining us on Buffalo on the Rise. Give us what the vision is for your practice. What made you start the practice itself?
So Lakeshore Eye Care started in Irving, New York. Our goal was to bring a world-class experience to patients in the rural setting. Since then, we expanded into the Hamburg market. And even to this day, we see patients from all over Western New York. Our goal is to really provide a very personalized experience, especially for cataract surgery, eyelid surgery. I'm with the patient every step of the way, before, during, and after the procedure. And that's really our goal. This can be at times, a scary process for some folks. But we want to make this very comfortable. We want to make patients very at ease when we embark on this journey, essentially.
You know, I think my mother would have been a lot happier if I had been either a doctor or a priest and not a disc jockey. So, I congratulate you on that. When you start talking about a cataract surgery, when does somebody actually know? Is there a magic age that you get to where they say, oh, you're going to have cataract surgery? How does that come about?
So really, the patient will notice problems with their vision, glare, light sensitivity, filmy, foggy vision. You're right, age does factor into this. If a patient comes in very young, in their 20s or 30s, there could be other issues at work. But generally speaking, sure, if there are patients that are 60s, even in their 50s to some extent, and they have some of these visual complaints, the first step would be to have a comprehensive eye exam, which is something that we routinely do. And in some instances, this can very easily be corrected with glasses. If we find that a patient is going to need more than glasses, and that's where potentially the cataract surgery, the cataract procedure comes into play.
Do you hear from individuals, as I've gotten older, I heard from people who say, I don't like to drive anymore at night. The lights are glaring, or it constantly looks like I get reflections or whatever. Is this something that's associated with cataracts?
Absolutely, and that's one of the hallmarks. If there is some impairment, some reduced function in an individual's activities of daily living, that's where absolutely getting checked out, having the eyes looked at is the starting point.
Now, explain to us, if you will, what happens when you actually get cataract surgery?
So when you have cataract surgery, you typically will have this done in a surgery center. The day of your procedure will typically require you to be at the facility earlier in the morning, 7:15, 8:15, 9:15. Our nursing team typically will start an IV. You'll meet one of our anesthesia doctors. The patient will meet me. We'll then head into the procedure. Procedurally, this is typically performed in minutes. We use some of the more modern techniques. There's no needles, no injections. And in essentially the span of minutes, the patient is completed the surgery. They're given a box of juice, because typically we have patients not eat anything the day of their procedure, and they go home. And we typically will tell folks, no heavy lifting, no bending, just take it easy. And then we reevaluate the patient in the morning to see how they're doing.
Now, are you actually implanting something, or you're removing something from the eye?
Both. That's a great point. So as the cataract develops, typically a film starts to form on the lens, which is very similar to what we're seeing here. Mm-hmm. At birth, the lens is crystal clear. And we go in, remove this structure, and then we'll put a lens implant, similar to what you're seeing here, directly into the eye. And today, lens implant technology has really evolved, where we can put a lens implant that can give someone great distance vision without glasses. We can put a lens implant that can help someone with distance and also reading without glasses. So it is a very exciting time in the world of cataract surgery.
You know, I couldn't even do, contact lenses because I have this phobia about touching my eye. So when you start talking about surgery and start talking about actually doing work on the eye itself, does it hurt?
No, typically this is very painless. Our technology, our drops, patients really don't feel anything. And of course, with modern anesthesia, patients are typically conscious sedation, very similar in dental care, very similar in GI care, and of course eye care. So the patient really has no perception of what's happening other than, what? The surgery is over, that's it, we're done? Yeah, we're done, you did great.
And you just have to have a driver to bring you there and bring you home
Absolutely.
afterwards.
In New York State, and probably in most states, if you are given a sedative, a family member or friend should take you home after your procedure.
And what about somebody that has, I know like my dad, his eyelids kind of drooped as he got older? Is there something that you can do for that?
Yeah, absolutely. Eyelid surgery is a big part of our practice. As we get older, the aging process sets in. It becomes more difficult. We start raising our eyelids like this. And this is a procedure that can, a lot of the times, be billed to the insurance if certain requirements are met, if certain testing is successfully completed.
See, if only Sleepy and Droopy of the Seven Dwarfs knew about you at the time. Tell us about your locations.
So as I said initially, our original practice is in Irving, New York, and our newest office is in Hamburg. I shouldn't say new, we've been in the Hamburg market since 2009, but we are happy to serve patients. One of our goals, if patients call, we try to get them scheduled promptly. Every patient is going to personally see me. I will personally walk every individual through the lens options. And again, even if it's just for routine eye care, it's not necessary that if there's a visual issue, oh, you have to have cataract surgery. There's a lot of things that we can even do with simple glasses.
Dr. Sharma, thank you so much for joining us this morning.
Thank you. Thanks for having me.
We appreciate it. For more information and answers to your questions, contact Lakeshore Eye Care by calling 716-698-9194 or go to lseyecare.com.
Sponsorship and promotional consideration for the preceding segment was provided by the following. Thanks for watching this edition of The Big Wack Presents Buffalo on the Rise. For information on this and other shows, go to our website, bigwack.com, and find out how you can participate on the program if you're a hometown business. I'm Joe Chili. Thanks for watching and listening to The Big Wack, Buffalo's oldie station.